Welcome to Mayo Clinic Q&A. I'm Dr. Helena Gazelka. Thanks for joining us today. A recent poll by the American Psychological Association found that 80% of American adults feel that the coronavirus pandemic is significantly stressing them. The survey also found that 60% of adults say they are overwhelmed by the number of issues that America currently faces, including healthcare, the economy, racism, and the political scene. Not to mention the election, which we are going through right now. Now, in addition, the holidays are looming. This is a time of year that often brings additional stress to families and relationships. Well, thank goodness that we have an expert here to discuss this with us today. He's going to help us learn how to cope better in these unsettling times. Dr. Craig Sawchuk is a psychologist at Mayo Clinic. In fact, he's the division chair of integrated behavioral health. Thanks for being with us again, Dr. Sawchuk.
Great. Well, thanks for having me. I tell you, there's stress is a growth industry these days. So the mental health colleagues are definitely not lacking for work these days.
That's right. I always tell people that I specialized in pain medicine because it will never be eradicated and I'll always have a job. But boy, I feel like you are in high demand as well.
I tell you, it's a never-ending struggle the way the world works. But again, that's why we're here to help.
This has been a pretty divisive time. Individuals are disagreeing over lots of things, including the political scene and COVID-19 precautions. What advice do you give to people to try to maintain their relationships while they may be disagreeing with others, and that would be in the home or in the workplace?
Right. So we're definitely seeing that, as you say, across lots of different relationships, in our lives. Historically, we can compartmentalize some of these places. Like I can leave my work stuff at work. I can sometimes leave my home stuff at home and social stuff socially, but they're all kind of bleeding together, right now. And we're all really opinionated, as well too, which is really good to have a voice, but sometimes it causes that friction. So I think, some of the things to always remember that as humans, we're social animals. So we really need social relationships. It's so helpful for our functioning. And we think of like even earlier in the pandemic with social distancing and stay-at-home orders, we were encouraging everybody to like rapidly adapt to virtual relationships, and people did and have been doing a great job with that as well too. One of the things that we're realizing we're in the long haul, for these virtual adaptations, it's also like taking good stock of who you're spending your time interacting with, both, at work and at home and socially as well too. So it's important to take stock of who are those people in your life in those different pockets that we just talked about, that are more positive, maybe more reliably bring you up, make you feel good, who sometimes are like really cool and okay with having ground rules of let's not talk about politics, let's not talk about the pandemic, let's not talk about some of these divisive things, so we can really focus in on what's good about these social connections. And likewise, it's good to put limits on some of those folks that are well-intended, perhaps, but maybe what we're learning is the more that we're interacting with them, the more it's actually adding to our stress level rather than reducing that. So it may not ever lead to putting a restraining order, on these folks, or blocking them from some of our social media feeds or other things like that too. But sometimes we do need to set limits on folks that add more negativity into our lives.
It's a lot easier to hang up on people now when you're just texting them instead of talking on the phone.
Yeah, or suddenly I'm having technical problems and we're clicking out on folks. So yes, we have some additional excuses in our tool belts now.
That's right. Well, Craig, my daughter is a young adult, and when she's having a struggle, she loves to say, well, welcome to adulting, Mom. Stress is part of adulting. We all face stresses in our life. And I'm wondering, how do we know if stress is getting too much for us? In other words, if we're not managing it well, what should we look for and what should we do?
Yeah, wouldn't it be nice to say, hey, I'm not feeling particularly stressed. Remember what those days kind of felt like. So I think it's always important to remember that stress is just part of being alive, and I know that especially in the context that we're talking about this now and what's going on in the world, stress just has this negative connotation, but it's not. It helps to motivate us. It helps us to get things done. It helps to power us through various things. But there's, just like with most things in life, at what point does it become too much of a good thing? And we all have this kind of internal stressometer that we experience, and it's kind of like an alarm system that goes off, and we all express and experience our distress in a slightly different way. So you can kind of break it out into different categories. Some people, they feel it really physically. So this is where, they have the headaches and they have the stomach problems. They feel like a lot of that tension. Sleep disruption can be a really, common thing. We can also think about emotionally. Sometimes people get like really flat and almost like maybe a little too serious, for us. So sometimes they get more irritable and edgy. A third way is like how we think and how that changes. So when we find our mind is racing more, kind of worries, ruminations, or sometimes the information processing part of difficulties concentrating can be a marker for us. And then behaviorally, if we find that we're like withdrawing or avoiding, or maybe some unhealthy habits, like maybe drinking a little bit too much, starts to pick up. So it's really important to know for ourselves, kind of like our personal engineering is seeing how our stressometer is actually built. What are the types of signals, or what does it sound like when it goes off for us? And then in turn, a lot of those stress management strategies can actually map on very nicely in terms of how that alarm goes off. So if we're having more of those physical symptoms, that's where some of those resilience building things that we've been talking a lot about during the pandemic, like sleep regulation, exercise, yoga, relaxation skills can be really, really helpful. If there's more like our mind is racing a lot, there's some really good, cognitive challenging and reframing skills, and even some mindfulness skills can be, really good. So I think that's where take stock of where your stressometer is at, and how it's going off, and then really think through some different strategies that can actually be helpful in calming down those parts of the reaction there.
Well, with all of the stresses and interpersonal relationships, and particularly at this time of the year, the holidays and everything else that's going on, that can be tough. But the flip side of that is that there are many people who are lonely, and that loneliness may be a big issue during COVID-19. How do we help people to deal with the social isolation that can be happening around this time?
Yeah, it really is a challenge now. We're kind of in this interesting balancing act. So on the one hand, on the public health standpoint, what are we being asked to do that helps to reduce community spread? Well, we social distance. We are doing some quarantining, reducing travel, not congregating, all of those like really good things that helps to reduce our risk for viral exposure and transmission. But at the same time, it's kind of like increasing our risk over here for loneliness and feeling disconnected, from others. So it really is this kind of interesting balancing act that we're caught up in right now. Um, when we think back, I mentioned a little bit earlier that we're social animals by nature. Boy, the value of just these brief but frequent social contacts, kind of throughout the day, are so good. And once that's been taken away because of our schedules have changed so much, and we're doing a lot more social distancing and not exploring, quite as much these days. Boy, we really feel it and we really miss it. So really continue to encourage folks to really continue to work on building up that virtual social support stamina. That is like unbelievably important. What we're encouraging people to do is again take some ownership over that, kind of see where you're at in terms of your own level of loneliness, and whether it be like once a day or setting goals during the week of making sure that we're proactively reaching out, to folks. And again, just like we were talking about a little bit earlier on, really focus on quality of the folks that you're reaching out to rather than quantity, per se, so that we're hopefully connecting with those more positive folks, in our life. But then also try to look at it in the other way around too. We may be doing relatively okay with managing, the social distancing and the less social contact, but there may be others that are important to us that maybe are more vulnerable, and maybe more vulnerable to isolation. So also reaching out to other folks as well too is really important. But I'm really a big fan about setting either daily or weekly goals for deliberately reaching out to folks. But definitely keep up that virtual social support stamina. I know how desperately we all want to get back, to being together, but we are in a pandemic, so it makes it really challenging now.
Well, speaking of being together, if we can say one thing about 2020, it's been a year of change. Many people have changed the way they work. So a lot of people are teleworking now who didn't used to work from home, and we're being discouraged from large gatherings where people might get together after work and share some visiting time, etc. I'm wondering, what are the challenges of teleworking from a psychological perspective, and how do we help our coworkers to deal with them?
Well, a classic psychological response to that is, well, it depends, because there are some folks with the way that the pandemic has really forced a lot of different industries, healthcare and business and education, all sorts of industries, that there actually has been an advantage, for some folks and some pockets of the industry where teleworking is actually like a really good boost in quality of living. Um, but it's always important to keep in mind a couple of questions. The first is, how easily does the nature of your work, your job, your tasks, and your responsibilities, how easily does that actually translate into a teleworking, situation? And there may be certain tasks and responsibilities that translate over very well, and other ones that actually are really, really tough. So people are really struggling with a lot of inefficiencies, that have come along with their work. So that's one thing, is that not all work related tasks easily translate over. And the second thing that we also want to pay attention to is that home office environment, built to be conducive to work as well. It sounds great. Hey, I don't have to commute, or it's really easy to be able to roll out of bed and quickly get changed and go into my home office. But really, is it? So we can think about it from just like a raw, technical, standpoint. Do you have all the equipment that you need to do teleworking efficiently? But what else has happened during the pandemic? Oh, kids are at home. Our pets that are used to not having us maybe at home because we're at the office during the day, suddenly it's like mom and dad are home. This is great. So they may be busting in and interfering with that. At home, there's things that we can more easily procrastinate with sometimes, or there's like chore things that we do. So the environment is tricky as well. And for some people, it's easier the way that their home is built, that they can actually have that home office. And for other folks, it makes it that much more challenging. So that's why it's really, really important, I think, from an employer standpoint and our supervisors or managers, to really watch out of not getting caught up in blaming the victim here, is that having those discussions with the employees about reasonable expectations regarding their work, especially, as we're talking about all these different stressors going on, both locally and nationally and globally. There is a higher stress load going on right now. So it also may be more challenging from a work productivity standpoint.
Thanksgiving is a wonderful holiday. We always look forward to getting together with friends and family and enjoying a long weekend, but it can also be stressful. And I think there are additional stresses for some individuals this year as they contemplate how to get together safely with their family. We've discussed this a little bit on other podcasts. What recommendations do you have for individuals whose family members may not want to follow the rules this year, and how they can discuss that in a meaningful and constructive way without igniting a powder keg?
Yeah, well, good luck with that, eh? But so I'm Canadian. So we had Canadian Thanksgiving back in October. I was not allowed to leave the country, so we were naturally able to socially distance from my family. But Canada got through Thanksgiving in October. But here we are on the doorstep of Thanksgiving in the U.S. And we think of like back to 2019 around this time of year. Yeah, we would be thinking about kind of managing some of the family dynamics, but now this year it's take a completely different spin on things for, again, a variety of reasons that we were talking about earlier, all the new stressors and people being really charged up about certain things. But one of the biggest things I'm seeing clinically and talking with folks about is how to navigate differences of opinion, shall we say, regarding social distancing and precautions there. So if we think of, well, what's the purpose of the holiday in the first place of Thanksgiving? It's getting together, and how do we do it? Well, we get together in a small space, an enclosed area. We get, we're talking a lot, we're sharing food, all of those things that are part of the celebration. We spend lots of time in one place in that space, and or depending upon how the family is set up, we may be traveling from one Thanksgiving dinner or get together to another. And if we think about it from a public health standpoint, it's like, oh, it's exactly the opposite of what we want to do. So it's a really, really, this is a really difficult time. And in your powder cake analogy is spot on. I think what's really important is, again, we got to look at following public health safety guidelines. It's never a guarantee that we will be infected going to a get together or a party. We think of the unit of analysis of a virus. It's not like the beach balls floating around in the air so we can easily kind of maneuver. It's the unit of analysis is really small, and it's hard to know for sure whether or not we're going to be infected. But if we actually do look at what's happened with other social gatherings along the way, whether it be graduations or weddings or other get-togethers, that's where we've seen spreads happen. And I think that this is the unintended, consequence, that we're not planning on getting together so we can spread the virus, but this is actually a high risk factor right now. So I think what's really important for an individual or for a couple when they're making decisions regarding their families is they make decisions that are important to their values. So if our values, what, been working really hard to maintain our bubble, and we're taking all those necessary precautions with our family, that is something that we want to communicate to whoever we're planning on ordinarily spending Thanksgiving with. We encourage folks to have those conversations now. So I'm glad that we're talking about this now and not like the night before Thanksgiving or the day of. So at least buying some time and starting to broker, those discussions. And I think what's really important too is to not turn it into a debate. This isn't about like our beliefs around, the virus and the transmission or other things. And this is certainly not meant to feel guilty about setting some boundaries and some limits. This is a decision that either an individual or, a family makes to decide not to do it in the traditional way that we've done it in the past. And that's why all of our discussions, we kind of ended in a period, that this is what we're choosing to do this year. And if somebody tries to lay some guilt on us, just do the broken record routine. This is what we've decided to do as a family this year. And again, there's compensatory things that I know people are trying to do as best as they can to make the celebration special, in home, in their own bubble, also virtually, connecting with others during Thanksgiving. Again, I know it's a short-term sacrifice, it really is, but we're really trying to do everything we can to help flatten the curve and do our part to be able to settle the pandemic down.
You and I have talked in the past about how setting limits can actually be a stress relieving process if we are able to stick to those limits. Well, the holidays are a time that we traditionally think about lots of eating and drinking, particularly in the presence of family members and friends. Now we add a pandemic with even more stress. How do we set limits and then stick to them?
Yeah, it's kind of, again, we put pandemic and stress aside. This is a challenge of being human. We like to eat and we like to drink, and we think of just like culturally, that's a big thing of what we do. We kind of celebrate, and especially, this time of year, normally we're all kind of getting prepared that, yeah, we may be putting on a few pounds, and it's never a fair equation, right? It's easier to put weight on than it is to take off. So that's something that we're kind of used to year in and year out. It'll be curious, to see how things actually go this year, because over the course of the pandemic, there's been a number of people who have actually gained really good momentum with developing healthy habits, with limiting, their alcohol intake, focusing in on healthier eating, preparing, meals at home, and then maybe not eating out, quite as much. So there actually is a good chunk of people who have developed really good health habits and heading into the holiday season, that they actually may be in that rhythm, kind of that habitual rhythm where they may be able to navigate that a little bit easier. And then unfortunately, the flip side is that there's many of us too that have really kind of struggled, with our eating habits and maybe our drinking habits as well too. Whether it be that I'm around home a lot more and I'm not getting out quite as much, so it makes it a little bit easier to graze, or sometimes whether it be stress or just something to do, maybe they're drinking a little bit more, during the week. I think it's always, that key thing of kind of knowing your limits and trying to stay with it. It's also being uh, compassionate towards ourselves as well too, because remember, if we put the pandemic aside, which is like almost impossible to do, it's normal this time of year that we eat more, we kind of maybe derail a little bit from some of our healthy habits to get back on track as time goes along. I think what's important for us is just kind of know what are our risks, what are some of our triggers. So sometimes when we're thinking about shopping and what are we bringing into our home, just being conscientious about those limits, that maybe if you're like drinking, maybe get a six pack rather than a flat, a beer, bringing in, or try to limit the amount of carbohydrates or sugars that are coming into. And again, remember, and we'll probably talk about this in a little bit, we're getting into that time of year where it's getting darker outside, and that drive for more carbohydrate craving starts to come up. So watching what you bring into the house is good. And then one last thing that can be helpful too is make ourselves accountable to others. So if you've got like a family member, a partner, a friend, where you guys can commit together to say, hey, you know what, let's just watch what we're eating, let's try to get back on our exercise routine together, we can navigate through this time.
You mentioned shorter days. We recently just fell back daylight savings, and I've already been kind of mourning the loss of that extra daylight at the end of my day, and I'm sure others too. We're facing months of shorter days and a little bit longer nights now. And I know that you have a great interest in seasonal affective disorder, which occurs every year in this situation, but how will it be affected by the pandemic? Do you think there will be differences for people this year?
Yeah, we're certainly have our radars up in terms of seeing what actually happens with seasonal depression this year, because on the one side, we may be seeing some resiliency heading into this time, because again, some people, many people have made some pretty healthy changes earlier in the pandemic, and that's like resiliency building will help carry them through maybe during this time of diminished light. And then on the flip side, we wonder, are there going to be new populations that are struggling with seasonal depression that maybe hadn't struggled too much with seasonal depression, maybe had struggled a little bit with winter blues. But I think those folks may be operating already at a deficit. So like we were talking about social isolation and maybe some disruption in some healthy routines and other social contacts, they actually may be operating at a deficit heading into the seasonal time. So we actually may see those rates go up. So we've already been trying to get ahead and messaging out to folks, and this is a great venue for that as well too, is to pay attention to that mood. And remember, with seasonal depression, it's kind of like a hibernation syndrome. So the symptoms are that we tend to get a lot more fatigued, a lot more tired. We want to sleep more. So it's kind of that hyper, somnia. The carbohydrate cravings go up, weight gain increases, that mood kind of flattens out, and it's more of that blah type of thing. So all of those healthy habits that we've talked about a lot all the time, with watching our sleep and especially not sleeping too much. It's less about insomnia, more about sleeping too much. So sleep regulation is a really, really big thing. Making sure that we're getting some exercise, trying to get outside, even on cold, sunny days. That's natural light, and that can actually be really helpful to us. having a normal routine when we wake up in the morning and get the lights on. Get the lights on inside, open up, the drapes and the blinds as much as we can to get that light in. And then for some of us, we actually do need to use those lights, those sun lamps that can actually be really helpful. And we remember that clinical practice guidelines, a 10,000 lux intensity bright light that we keep usually about 3 feet away from us. You want to use it within the first hour that you wake up in the morning for about 15 to 20 minutes, maybe up to a half hour. That can actually be really helpful and carry us through that time. So there may be folks that maybe truly don't meet diagnostic criteria for seasonal depression, but maybe even using the light therapy can actually help float their boat and get by during the season.
Craig, you have given us great tips for helping ourselves and those we are close to manage stress and anxiety, both at this time of the year in general and during the pandemic. Sometimes people may need some extra help, maybe from a psychologist or their therapist. How do they go about finding that if they need it, and even knowing if that's what they should pursue?
Thank you for bringing that up as well too, and we really encourage folks to be as transparent as they can with the people that they care about and the care teams that work with them, like their family medicine, primary care, pediatric provider as well too. One of the things that we've talked about our last couple of years on this program is looking at mental health as just part of our health. It really is just right up there with all other aspects of our health, and culturally the stigma has been going down. Our primary care family medicine teams have much more comfortable with asking about these things. So being transparent if we're struggling. We were talking earlier on about the stressometer, kind of where we're at with that, and when we do find that our mood, our stress level is really getting away, or getting to the point where it's getting in the way of being able to take care of the normal things, in day-to-day living, or the ordinary downtimes that we have, whether it be our weekends or during the night, that those are starting to get contaminated and disrupted by stress. Those are good times, to be able to reach out. So usually one of my first places that I encourage people to do is to talk with our primary care, family medicine, and pediatricians. Those treatment teams are interconnected with the local area resources, so may help be the air traffic controllers to get us connected with those right resources. Contacting your insurance company directly can also be a good one to find a list of in-network providers that could be of help to you. A couple of websites that we've recommended in the past, the Association for Behavioral and Cognitive Therapy, so abct.org, or the Anxiety and Depression Association of America, so adaa.org. They've got therapist locator websites that are, again, internationally, can help you identify providers in your local area that are also skilled in evidence-based practices. And that's so important, and that there's great evidence-based treatments that are available and that can be helpful with being able to get you connected with these interventions. And then also on these websites, there's also a listing of great self-help books and apps. So those are also great resources as well.
I appreciate what you said about whole person care, Craig. I tell my pain patients regularly that I can help them with their pain, but that's just a symptom, and I wouldn't be doing them a service if I didn't inquire and help them manage whole person care, including their psychological state and their mood.
Yeah, our two businesses aren't quite different, are they?
Well, thank you so much for being here with us, Dr. Craig Sawchuk, a psychologist at the Mayo Clinic. You've given us some great tips for dealing with stress and anxiety, and we sure appreciate it. Thanks to you too for joining us today. I hope you learned some great tips that you can put into practice today, and I do wish you a wonderful day.
Mayo Clinic Q&A is a production of the Mayo Clinic News Network and is available wherever you get and subscribe to your favorite podcasts. To see a list of all Mayo Clinic podcasts, visit newsnetwork.mayoclinic.org. Then click on Podcasts. Thanks for listening, and be well.